This medication is a combination of two antibiotics, sulfamethoxazole and trimethoprim. It is used to treat a wide variety of bacterial infections such as middle ear, urine, respiratory, and intestinal infections. It is also used to prevent and treat a certain type of pneumonia, known as pneumocystis-type pneumonia. This medication should not be used by children less than 2 months of age due to the risk of serious side effects. It's important to note that this medication treats only certain types of infections and will not work for viral infections, such as the flu. It is crucial to take this medication as directed by your doctor, and to not misuse or overuse it, as this can lead to decreased effectiveness. The daily dosage and optimal timing for taking this medication can vary depending on the specific infection being treated, so be sure to follow your doctor's instructions carefully. Before taking sulfamethoxazole-Trimethoprim suspension, make sure to shake the medication well. Use a special measuring device to carefully measure the dose, and avoid using a household spoon. Take the medication by mouth with a full glass of water, as directed by your doctor. If you experience stomach upset, you can take it with food or milk. It's important to drink plenty of fluids while taking this medication to lower the risk of kidney stones forming, unless your doctor tells you otherwise. The dosage will depend on your medical condition and how you respond to the treatment. For the best results, take this antibiotic at evenly spaced times. Try to take it at the same time every day to help you remember. Make sure to continue taking this medication until you finish the full prescribed amount, even if your symptoms improve. Stopping the medication too early could result in the infection coming back. If your condition doesn't improve or gets worse, be sure to let your doctor know. Some common side effects of sulfamethoxazole-Trimethoprim suspension may include nausea, vomiting, diarrhea, and loss of appetite. If any of these effects persist or worsen, it's important to contact your doctor or pharmacist. Remember that your doctor has prescribed this medication because they believe the benefits to you outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. However, it's important to seek medical attention if you experience any serious side effects, such as muscle weakness, mental/mood changes, signs of kidney problems, extreme drowsiness, or signs of low blood sugar. In rare cases, this medication may cause a severe intestinal condition called C. difficile. If you develop symptoms such as persistent diarrhea, abdominal pain, or blood/mucus in your stool, notify your doctor immediately. Do not use anti-diarrhea products as they may worsen the condition. Prolonged use of this medication may result in oral thrush or a new yeast infection. Contact your doctor if you notice any changes in your mouth or vaginal discharge. Sulfamethoxazole-Trimethoprim suspension may also rarely cause serious allergic reactions and other side effects such as a severe peeling skin rash, blood disorders, liver damage, or lung injury. Seek medical help if you experience symptoms such as sore throat, fever, persistent cough, skin rash, swelling, unusual tiredness, or dark urine. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist for advice. Remember that it's crucial to seek medical attention for any concerning symptoms. Before starting this medication, it's important to let your doctor or pharmacist know if you have any allergies to sulfamethoxazole, trimethoprim, or sulfa medications, as this product may contain inactive ingredients that can cause allergic reactions. You should also discuss your medical history with your healthcare professional, especially if you have kidney disease, liver disease, blood disorders, severe allergies, asthma, or diabetes. It's important to be aware that this medication may cause live bacterial vaccines, such as the typhoid vaccine, to not work as well. Before getting any immunizations or vaccinations, make sure to inform your healthcare professional that you are using this medication. Additionally, this medication may make you more sensitive to the sun, so it's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. If you have diabetes, this product may affect your blood sugar, so be sure to check your blood sugar regularly and share the results with your doctor. It's also important to note that older adults and patients with AIDS may be more sensitive to the side effects of this drug, such as skin reactions, blood disorders, and high potassium levels. If you are pregnant or planning to become pregnant, it's important to discuss the risks and benefits of this medication with your doctor, as it may harm an unborn baby. This drug also passes into breast milk, so if you are breastfeeding, it's important to consult your doctor before continuing to breastfeed. It's important to be aware of potential drug interactions when taking sulfamethoxazole-Trimethoprim suspension. This medication may interact with certain other drugs, such as blood thinners, such as warfarin, dofetilide, methenamine, and methotrexate. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Additionally, this medication may interfere with certain lab tests, so be sure to inform lab personnel and all your doctors that you are taking this medication. If someone has taken too much sulfamethoxazole-Trimethoprim suspension and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the Poison Control Center at 1-800-222-1222, while residents of Canada can call their provincial Poison Control Center. Symptoms of an overdose may include severe nausea, vomiting, diarrhea, dizziness, drowsiness, or changes in mental/mood. Remember, it's important not to share this medication with others. This medication is specifically prescribed for your current condition, so it's crucial not to save it for another infection unless your doctor advises you to do so. If you're taking this medication for an extended period, you may need to undergo lab and/or medical tests, such as a complete blood count, kidney function tests, potassium blood level tests, and cultures. Be sure to attend all of your medical and lab appointments, and consult your doctor for more information. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take the next dose at your regular time. Don't take extra to make up for the missed dose. Make sure to store the sulfamethoxazole-Trimethoprim suspension at room temperature, away from light and moisture. It's important to keep it out of the reach of children and pets. When you no longer need the medication or it's expired, make sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. And remember, don't flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.